Hey guys, we're going to be talking this Ed puzzle about what to expect when you are doing Lab 2, which is going to be coming out next week. This week, we're going to be talking really or concentrating mostly on what it is to do a quick screen. You've probably done quick screens with Dr. Bennett or maybe Dr. Christensen, but we're going to be digging a little bit deeper into what it is and what entails for us to do a quick screen and what we're going to get from our patient or from our client. So you're going to be asked to pair up and work with a partner for this semester or even just for this specific content and then switch it up next time. That's okay too. But I want you to really think about who you want your partner to be. I don't want you to pick your partner just based on they are your best friend or the person that you really want to be with or talk to or things like that. I want you to think of somebody in your group that is going to push you to a little bit harder, who's going to really help you think a little deeper than what you're doing already and to have a better understanding of what we're going to be working on. So we know what range of motion and manual muscle testing is, right? We've done this. You've done this with Dr. Christensen and you've done it with Dr. Bacon, maybe Dr. Bacon and Dr. Bennett. So what I want to do is take a minute right now and have you just jot down what you can explain to me about what range of motion is and what manual muscle testing is and how it affects a person's ability to engage in something, some kind of occupational performance. Okay, these next few slides talk about what normal range of motion is. This is something you probably have in your notes, but I wanted to have it here for you as well. Because once you understand what normal range of motion is for each joint, then you're better able to identify when something is abnormal or is lacking what would be expected of that joint mobility. So we're going to be looking at the shoulder and the elbow and the forearm. We're going to be looking at the wrist and the thumb and also the fingers. The next thing we're going to look at is muscle strengths. So we want to understand what is normal, right? I mean, we understand that normal, according to this rating, is 5 based on a number scale or normal, which means that the person can move through complete range of motion against gravity with maximal resistance. But we also have to understand that what's normal for you as maybe a 22-year-old may not be exactly what we would say normal for a 75-year-old, right? So a 75-year-old, their normal range of motion might actually be at the 4 level, right? Because that's what they're able to do. And that's okay. So that's kind of what we would call functional range of motion, or I'm sorry, functional muscle strength. So we're going to talk more about that as well. So when we do a quick screen, this is really identifying what the client is able to do. It's a quick overview. When you've done range of motion in manual muscle testing previously, and probably for your competency, you may have had 10 or 15 minutes to measure a joint or 2 joints. But in the real world, that doesn't really happen. Maybe you're only going to see a patient or client to do an evaluation for 15 minutes or a half hour. So you have to use your best skill level will be in the most efficient with your time. So when you do a quick screen, you have the client go through certain movement patterns, and you're going to assess how they move, what is their range of motion, what is their strength, and some other stuff, which we're going to talk about in a minute. And then you're going to pay more attention to the areas that the patient is deficit in. The quick screen also allows you to establish rapport with your client. Think about when you go to the doctor's office, okay? And the nurse comes in, and what do they do first? They first of all sit down and they say, "What's going on? My name is so-and-so. Tell me a little bit about why you're here." That's establishing rapport. That's what we want to be able to do with our clients. I have a quick video here. It's just a few seconds long. We're going to look at this and take a minute because when you're done, you're going to answer a question about the video.
Hi, Ryan.
Hi.
I'm Wendy, and I'll be your physical therapist today. This morning, what we're going to do is check the range of motion of your arms and to see how well you're moving. Okay? So what I'd like you to do is just follow what I do.
Okay.
So I'm going to have you lift your arms up overhead and come back down and back out up to the side. And now put them behind your head the small of your back to either shoulder, same shoulder. Good, and then bring your arms in at your side, and bring your elbows back, and then bring your arms straight out. And tuck them back in again. Palms down, palms up, wrists up, wrists down. Open up your fingers and make a fist. Good.
Whoops. Hi. So I want you to take a minute and just jot down what you saw in this video. What did you see from the physical therapist point of view? And what did you see from the patient's point of view? What did you see happening in this video? In addition to a quick screen, OTs assess much more than just how a person moves. We're looking at visual tracking. So this is going to bring you back into your other coursework to tell me what visual pursuits are and what is saccades and what does convergence mean. You're going to be looking at that as part of the quick screen. If you see a problem, of course, then you're going to assess that further. You're going to look at a person's cognition, which is looking primarily at, are they alert and oriented times 3? You're going to look at a person's sensation, their balance, both sitting and sit to stand and transferring possibly. And then you're going to be looking at coordination of both sides of the body. This also can be incorporated while doing a quick ADL screen, such as donning and doffing a person's socks. When you're doing the quick screen for range of motion, you're going to initially introduce yourself. Make sure that the patient or client is positioned appropriately on the mat table or on the chair or on the bed, wherever it may be that you're actually doing the evaluation. But what does it mean to have appropriate positioning? Start thinking about that too. Then you're going to share what you're going to do with the client. So you have to be able to explain what you want the client to be able to do. Then you're going to do kind of like Simon says, follow me. So you're having them follow what you're doing. Then you're assessing in this very quick time frame. Think about how quick that video was that we just saw, but you're going to be assessing what was going on with that client and what else you need to assess further. At the end, actually week 3, you're going to be doing a competency. So there are no graded competencies in this lab or in this class. However, there are pass-fail, which means that you'll have to complete all of the components that are necessary in each of these competencies in order to get a passing grade. This is a quick rubric. You're going to introduce yourself to the client. You're going to assess their cognition. Then you're going to do upper extremity screening, which is outlined here. You're going to check the person's sensation, their coordination, and their balance. While doing this, you're also going to be looking at their vision, and we kind of talked about sensation already. Okay. Then the second part of this is more for your information. So while your classmates are completing their competencies, you will have an opportunity to look at a short video. And this first one is going to be about a gentleman who had a spinal cord injury. It's actually simulated, but I think it's okay. And you're going to be practicing what it is to write a SOAP note. We're going to be talking about SOAP notes in class anyway, but I want you to think about what goes into a SOAP note. What does it mean to have the S, the O, the A, and the P? And I'm going to give you a minute now to stop and fill that in. And then you're going to turn your SOAP notes in to me for feedback, and then I will hand them back to you. Here is a short template about what a SOAP note is. You may have seen this before, but it gives some good information about what goes into each section of the SOAP note. Okay, that's it for now. So thanks for watching this. Please complete the questions if you haven't done so already, and I will see you soon. Thanks, guys.